Lamar University, Dishman School of Nursing, Nursing 4580 Practicum, Synthesis of Professional Nursing. This is my capstone and 5 year career plan. My name is Nissa Morton, and I am a soon to be baccalaureate degree nurse from Lamar University in May of 2018. When I am back on my nursing education journey, I started as a licensed practical nurse in Florida. After practicing as an LPN in Florida for 1 year, working in the dermatology clinic, assisting the physicians with Mohs surgery and other skin cancer surgeries, I moved to Texas and transferred my license to become a licensed vocational nurse, where I worked as an LPN for several years. I decided to further my education and become a registered nurse in 2012. Now, currently, as a registered nurse, I am practicing in pediatric home health. I have clinical experience working in many different areas, such as outpatient surgery, school health nurse, and an RN educator for a home health company. Once I obtain my BSN, I plan to gain employment at the Texas Children's Outpatient Care Clinic. My goal is to become an RN educator at Texas Children's Hospital. As an RN educator, I will be able to share my experience with other nurses and families in the community. I will educate families about managing their child's healthcare needs. I feel that the Lamar University BSN program has prepared me to be a knowledgeable and a proficient professional nurse. My course experiences at Lamar University has helped me master the program program outcomes and helped me ponder critically and foster an evidence-based practice mindset. Baccalaureate degree nurses graduate using critical thinking, evidence-based practice, technology, and interprofessional and intraprofessional healthcare teamwork to provide safe patient-client care and improve patient-client outcomes. The first student learning outcome is states practice safe and effective holistic patient-centered care to a variety of patient clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. This outcome was met 95% by the Comprehensive Holistic Health Assessment course. The assignment that met this objective was the shadow health discussion, such as abdominal pain assessment. Shadow health was very difficult to me in the very beginning, but once I got the hang of it, I believed it was very informational and it taught me quite a bit to be able to have the virtual hospital and practice as many times as I needed to until I understood the material. The second student learning outcome states it supports patients and clients in preventing disease, maintaining wellness, and promoting and restoring health and advocating for death with dignity. This outcome was met 97% by the Care of Communities course. The assignment that met this objective was the CBSL Civic Pride and Diversity Initiative assignment. The third patient student learning outcome evaluates patient-centered care for the patients and clients across the lifespan based on common and complex health needs and compromise multiple health states when, when considering multiple determinants of health. This outcome was met 95% by the compromise multiple health states course. The assignment that met this objective was the CBSL Community Based Service Learning CBSL Activity PowerPoint, a memoir by J.B. Tyler, My Stroke of Insight. The memoir on the memoir about the physician in this book states a neurological problem because she had a stroke and she had to learn to do everything all over again. It was quite inspirational. The fourth student learning outcome states synthesis clinical synthesis clinical and judgment in nursing practice utilizes critical thinking, nurse process, research, and evidence-based practice. This goal was met 90% in the Comprehensive Holistic Health Assessment course. The assignment that met this objective was the Mr. Brian Foster Chest Pain Assessment on Shadow Health. The fifth student learning outcome employs safe, effective patient-centered care using theories and evidence-based findings in collaboration with patients, clients, and members of the interprofessional and intraprofessional healthcare team. This goal was met 94% in the Comprehensive Holistic Health Assessment course. The assignment that met this objective was the Danny Rivera Shadow Health Cough Assessment discussion. I was able to relate to the Shadow Health assessment since it was a school nurse and I have worked in school nursing for 4 years prior. And I understand what it's like when you have a family and you're trying to figure out what's going on and corresponding with the home and the child and trying to get an overall picture of exactly what's happening. The sixth student learning outcome differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients or clients as a member of the interprofessional and intraprofessional healthcare team. This goal was met 91% in the Nursing Theories and Online Education course. The assignment that met this objective was the Differentiated Essential Competencies (DECs) Formal APA paper. The seventh and the last student learning outcome demonstrates professional integrity, effective communication, active inquiry, and service to the community. This objective was met 97% in the Care of Communities course. The assignment that met this objective was the Practicum Project Planning Form 1 and Windshield Survey 2 assignment, where I got to speak to my neighbors in the geriatric population, spoke to them about what they thought about stuff, their diseases process, and educated them and interviewed them also on how they felt, how prepared they felt for natural disasters, how what was their plan, emergency plan, who was their support system. Found out a lot from that, and I acquired a friend of my next door neighbor who I still assist on a day-to-day basis up to this day due to this project. My 5-year career plan states that in year one, I plan on gaining employment with Texas Children's Hospital in the outpatient clinic. And this is 2018. As an outpatient clinic nurse, I will be caring for children of all age groups with complex health care needs. This position requires a BSN degree in which I will be able to apply for once I graduate in May. Year two, which would be 2019, I want to continue gaining experience within the complex care clinics and obtain specific certifications such as PALS and ACLS. Year three, which will be 2020, obtain experience in all clinics within the complex care clinics to solidify my experience. Year four, 2021, apply for a position as an RN educator with the Texas Children's Hospital system, teaching families about their child's complex care and empowering them with the confidence to manage their care at home, which will all lead up to year five, 2022. After I gain all the experience from year 1, 2, 3, and 4, I plan on year 5 acquiring the nurse education certifications as needed for Texas Children's Hospital and striving to achieve the head RN educator role at Texas Children's Hospital. I would love to be able to choose a specialty and educate families, develop education plans, and get much better at doing all this, including public speaking and making videos and PowerPoint presentations. I plan on really working up and building my experience in the future. As an RN educator, I will volunteer to become a preceptor for future nursing students in the community. With my clinical experiences and education, I will be able to provide information to families in need around our community and the state. As an RN, I will take responsibility and accept accountability for practicing within the legal scope of practice and am prepared to work in all healthcare settings. My references, I use the Texas Board of Nursing and Lamar University student handbook. Thank you. This was my presentation on my capstone and 5-year career plan. Thank you and have a blessed day.